everyone. Welcome. We are so glad you are joining us this evening for our third installation of CIM University. I am Piper Ruiz with Sacramento Running Association. And of course, we are California International Marathon coming up in just over 7 weeks. And we are absolutely delighted you've joined the call today. We're going to get kicked off right now at 6 o'clock. And we have our guest today, our panelist today is Dan McLean. He is a physical therapist and he has worked with Results Physical Therapy here in Sacramento for the last 10 years. And of course, he has been involved with Sacramento Running Association for the last 5 years. So I would love to kick us off for our third installation of CIM University. Tonight's topic is managing the aches and pains of marathon training. All right, Dan, take it away.
Well, thanks, Piper. Appreciate it. And thank everyone for joining the talk today. I do have a PowerPoint presentation, so let me pull that up as I share my screen here. Okay, and we'll go to presenter view. Perfect. So yeah, thank you guys for taking the time. I know we're kind of in the midst of training right now and coming up on CIM. So I think this is a pretty important topic. I think knowing how to manage the undoubtable aches and pains of marathon training is really, really important. And we'll talk about why that is important. But this is going to hopefully be a little bit more interactive of a talk. I don't want to just be sitting up here spouting a whole bunch of information at you guys. So if you guys have any questions or thoughts about some of the slides that we go over, some of the topics that we're talking about, feel free to shoot those questions in the chat as we go. We'll try to answer kind of little questions as we go, and then we will have a time at the end where we do some Q&A as well. So with that said, we're going to get right into the talk here and move on to our slides. So a little bit about myself. Piper did a good job of introing me. I was a collegiate basketball athlete at San Francisco State, and then I moved back to Sacramento to do my master's in physical therapy. And at that time, Dr. Rafael Escamillo is a huge biomechanist in our field. So learning about how the body moves and what muscles turn on, turn off with specific movements. That's what kind of attracted me to Sacramento. And then I did long-term training at Athletes Performance. Anyone heard of Athletes Performance or Exos? It's a huge training facility in the US, a lot of NFL guys, a lot of track and field athletes, baseball players. So it's a big training facility and they have some PT services. So it was really about working with the strength coaches, the nutritionists, the doctors, the chiropractors, the massage therapists, and everybody working together as a team to really help keep these athletes healthy and moving forward and even rehabbing them after injuries. So really good learning experience. When I moved back to Sacramento, I was looking for a facility that had a pretty similar layout, and that's where I found Results. Anyone heard of Results Physical Therapy? Okay, we got a couple people there. So I've been with Results over the last 10 years, been clinic director at the main Sacramento facility for the last 8 years. So really love, and I'll get into like what we do with the runners here. All these little certifications at the bottom are more trying to help bridge that gap between traditional physical therapy and return to performance or strength and conditioning and running, right? So those are just what those certifications are. As far as Results, these are some of the professional affiliations that we have within Sacramento. So Sac State Athletics, I do all of the rehab for their athletes and all of the different sports. They have 19 different sports. I'm specifically over football and track and field mostly, but do see athletes from the other sports. The Giants, we do every year we do a sports medicine conference with them. So we kind of head that up in San Francisco. That kind of ties in with the River Cats too, now being the Giants affiliate. And then Sacramento Republic FC, we do all their PT and their strength and conditioning. We have a couple of firefighter contracts too, so we get to see these guys and help them get back out and help in our community, which has been pretty big over the last few years. And then the SRA and Fleet Feet. SRA, I've been working with them over the last 5 years, like Piper said. And with Sac State, like I said, we see a lot of the track and field athletes, so really familiar with these running athletes, the type of injuries that we get when we do run for long distances or even short distances. because it is different than obviously a baseball player or a football player or something like that. So really familiar with those type of injuries. And the SRA, again, I do PT for their elite team. And then we also have like a strength and conditioning class that we do once a week with their elite team as well. So it's been really fun working with those guys. Fleet Feet down in off of J Street. I used to do running biomechanical analysis, which you guys will see in this presentation as well as injury screening from the store itself. We had a treadmill in the back there. So I did that for about 2 years. Was a really good program where people would come in, get their running biomechanical analysis. We get to see what their feet are doing with the shoes that they have, and then give some recommendations for the shoe fitting experts as well. So we're at a lot of live events too. Women's Fitness Festival, we've been out there for a number of years. CIM is kind of a big one for us and something that we love to be a part of and help runners locally and across the state, nation, and internationally. So you guys will see here, we have this is kind of what the expo looks like. And I was talking with Piper too. We have massage therapists, we have our PTs out there. We do cupping, Graston. We kind of work on stretching people out. Maybe people have had some tired legs after flying long distances. So we help get them in the compression boots. But I'm telling you guys all this so you guys can see kind of the global aspect of where we're coming from and how much familiarity we have with the running population, right? So the objectives tonight, and again, if you guys have any questions, concerns, go ahead and toss those questions into the chat box and we'll kind of tackle those as they go. The big thing we want to do is talk about the most common types of injuries. So if you have these little aches and pains and sorenesses, what may those lead up to, the risk factors for these injuries. And part of what we're going to do tonight too is a little screening. So that'll be kind of the interactive portion. We'll have you stand up, do some movements, and kind of do some self-screening. So we'll look at ankle mobility and hip mobility, and we'll talk about how those can lead to some of these injuries or sorenesses. We'll talk about some injury prevention techniques. So what you can do in order to decrease your risk for being injured, and the importance of screening, the functional movement screen, and running biomechanical analysis. So you guys will get to see what that is and why that's important. And then we'll talk about a runner-specific performance training program that every runner should be included in. And if there's anything we've learned over the last 5 to 10 years is we cannot just run consistently and that's all we do. We have to switch it up. You have to cross train. You have to do some strengthening. You have to do some swimming. You have to do some biking. You have to switch it up. The repetitive motion over and over again is what's causing some of these problems. So we'll talk about some recovery techniques too, what you guys can do on your own. But really what we want to do is we want to be a resource for you guys. If you go on Google and you search all this stuff, there's no shortage of information, whether it's right or wrong, on some of these injuries and why do I feel sore and what do I do to help my ankles or my knees? How do I keep training? Is biofreeze good? Foam rolling, what does it actually do? So hopefully we can get to some of those questions tonight and really, talk about some of these myths that may be happening and what the real information is and what's backed by science. Now, what's the big deal? Why are we even talking about this? Well, as you guys all know, that there has been a huge increase in recreational running over the last several years, and for good reason. I mean, it's easy. You can walk outside your house. You can go take off on a 5-6 mile run really easily. It's you don't have to drive anywhere. You don't have to go to a gym. You don't have to have a ton of equipment, and it's social. It's fun, right? You typically get a nice community of people around. You guys run together. It becomes more of your routine and your lifestyle. But the big problem is the injury risk for people who are starting to train for a marathon and first-time novice runners. The injury risk is between 20 to 80%. That's a huge percent risk when you're going to train for something like the CIM. We talk about chronic injury versus acute injury. So chronic injury happens over a prolonged period of time. So it's not like you just train for a couple months and you become injured. That would be more of an acute injury. Chronic injury would be trying to train for months and months, maybe years, and just beating your body up over time. There's certain things that come with that. The big problem with injury is injury leads to inactivity, depression, isolation, and anyone who has had something taken away from them that they really enjoy doing can speak to that, right? Nobody likes to be told they can't do something, and especially if that something is a big stress manager in their life. or that's their only social interaction that they get, or they enjoy doing it with their friends and they can't do that anymore, so they feel isolated and left out. For this reason, millions of dollars are spent per year on doctor's visits, PT visits, chiropractor visits, podiatrists, orthotics, shoes, all that stuff. So not only do we want to make you feel good by continuing to run, we also want to keep some money in your pocket too without having to see a lot of these specialists. So I do have the first question of the night for you guys. How many on this call are first-time marathon runners? And you guys can just type in the chat really quick. If you are a first-time marathon runner, just go ahead and say yes. If you are not, say no. Toss that in there. We'll get to, oh, good. And a lot of first-timers right here. We got yes, 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 first-timer. We got one no. The majority of people on here are yes, I am, yes, yes. Yep. Good. Yeah, a lot of first timers. And I think when we do these presentations, and this is the 5th presentation I've given on this topic for CIM University, we do have a lot of first time marathoners, which is great. And I think that's why people are joining these CIM University talks, to get a little bit more information, right? Okay, the big problem with being a first time marathoner, again, what we just talked about, is the injury risk for you guys is really, really high. So I'm glad you guys are on this call. I'm glad you guys are talking this out with me, because hopefully you can take some of this information and utilize it over the next several months to continue to run a lot more efficiently and safely leading up to the marathon. All right, so with that, a big thing that we have to talk about is soreness versus pain. And who knows the difference between soreness versus pain? It's kind of muddy water, right? You know, it's not as clear cut. There is a little gray area there. I think this little chart over here on the left-hand side of the screen is really good. And if you look at this, this is kind of a little pain scale that you can use. So if you're running, let's say you run and you have some soreness during the run, it kind of goes away, but it's more of like a 1 or 2 out of 10 soreness, you're probably okay. If you get into that 4 or 5, let's say you get halfway through your run, it's like, oh man, this is getting up there. I can still run, but it doesn't feel very good. Probably more in the 4 or 5 range. If you get higher than that, we're calling that excessive. So you guys can see the green light, yellow light, red light. And this is very important, because you don't want to push your body too far too soon. And what that can do is kind of pull you out of training altogether. So if you're in that excessive range, that's 6 out of 10, you may have to rethink what you're doing and maybe get something looked at. If it's 4 or 5, that's kind of acceptable, as long as it's mild pain and it settles within 24 hours. So this is huge. This is big. If you have mild pain that settles within 24 hours, that tells you that your body is able to withstand the force that you're putting through it during that time, right? But if it's higher than that, then we're starting to do a little bit, I don't want to say tissue damage, but the force that we're putting through our tissues, probably too great for what they can withstand right now, whether it's fatigue, whether we're not strong enough, whether we haven't trained enough, anything like that. Now over here on the right, we have 4 different phases of injury, or 4 different phases of pain. One is pain that's after activity. So this is, you go on that 8-mile run, no pain during, but later on that evening, you're a little sore, right? That's kind of phase 1. So you want to start to pay attention to that. Phase 2 would be pain during activity, but it doesn't restrict your performance. So on that same 8-mile run, maybe you're running and like mile 4, mile 5, you have some pain, but you're still hitting your time, you're still hitting your pace. It doesn't affect your performance. Unfortunately, I start to see people, and other healthcare providers start to see people, when we hit stage 3. So that's pain during activity that restricts performance. So now, let's say you're scheduled to go for an 8-mile run, you start to run, but you only get through 6 of those miles because you have pain. Now it's starting to affect your performance. Or you're on track to do a pace of 8.5 miles per minute, or 8.5 minutes per mile, but you're getting into the 9s and 10s because you have pain and it's forcing you to slow down. So unfortunately, this is where we start to see people. And then at this point, it becomes a little bit more difficult to say, okay, we can work with you a little bit. You can continue to run, but let's work on these things. If we catch it in the first two phases, it's a lot easier to kind of get rid of and take care of and continue your training, right? Phase 4 is pain at rest, unremitting pain. And this is where we've kind of gone too far. A good example of this is you run, and all of a sudden, boom, it hits you. You have to stop your run. You're sore the next day. You have pain, maybe walking the next day. It doesn't go away for several weeks. This is a situation where, you know, you get into more of like a stress fracture situation. Anyone on the call have a stress fracture before? If you've had, go ahead and toss that in the chat. It's kind of like the kiss of death for a runner, right? It's probably one of the more severe injuries that we can get, and it's definitely an overuse type of issue. We'll look in the chat here. So got a couple, yep, not fun at all. I got Keegan on here. I don't run. I'm just here to see my main man, Dan, the animal. Thanks, Keegan. Yeah, so we got another one, tibia and tibia at the same time. So it is really tough to come back from a stress fracture. It takes months and months of the bone to kind of heal up. So if we get to that point where we can't run anymore, it's not good. But again, these are warning signs that our body is telling us before we get to that point. So think about those different phases. Anyone in this call, anyone in like phase 1, phase 2 of that soreness versus pain? Feels like it, yes, yep. And the stuff that we're going to talk about in these next slides are going to kind of help those people who are in phase 1 and phase 2, and we'll talk about that. There is a question in the chat here. Let me see. Where's the question? Okay, so Richard says, what about psychological pain? Thinking you are in pain. So this is important, and this is very important to talk about. Pain is very psychological, but it also can be mechanical as well. So trying to tease those things out, I think, and I know that we talk about this a lot, where if you think something is going to hurt, it's probably going to hurt. So you're already setting yourself up for failure there. If you think something's not going to hurt, then most of the time our brain, especially in these lower phases, we can kind of, I don't want to say trick ourselves, but really kind of push through some soreness. But again, if it's something that's consistent and it happens consistently at a certain mile or a certain intensity, then that's where we have to start thinking maybe it's more biological, maybe it is the tissue that has an issue, and then that's something that we need to get checked out. So we got having some left hamstring pain, fairly new onset. Yeah. So again, for those who are in phase 1 and 2, as we go through this presentation, hopefully you guys are going to get some good tips and tricks to kind of work on that soreness. Let me get out of the chat function here. Okay. So this is a study that they did with 2,000 marathon runners, and they took 2,000 marathon runners, all the people who had an injury during marathon training, and they were able to tease out different body regions that were injured during this marathon training. So you guys can see, obviously the knee is the #1 joint that gets affected with injuries in marathon training, followed by the foot and ankle. But the lower leg would be like the tibia or the shin area, hip and pelvis, Achilles and calf, and then the upper leg is kind of the upper thigh region, and low back. So low back's actually really low on this chart. Knee, foot, and ankle are kind of the biggest ones. That's what we see in the clinic as well. So again, why are we talking about injury? Who on this call does not want to perform well during this marathon, CIM? Who does not want to perform well? Good. Nobody should be raising their hand. Nobody should be putting anything like yes in the chat, right? Everybody wants to perform at their highest potential possible. But if there's no quicker way to decrease your performance than to have an injury, right? So this was a big collegiate race, and this is all over the internet, but you can see this runner here trying to be helped out by actually a couple rival colleges, and she's trying to be dragged across the finish line. How well do you think her time was during this run? Not very good, right? She didn't perform very well, but this is because she bonked out, she had an injury, right? So this is the importance, and I know we're talking about injury a lot, but trying to stay on top of these aches and pains is the number one way that you're going to continue to perform well. Because if you just push through stuff constantly, it's going to be very difficult to perform well at race day. So with that, most common pathologies that we see, this is that same study where they took 2,000 marathon runners. This is broken up in men and women. So if you're a man on this call, go ahead and look at that. If you're a woman, go ahead and look at that. They're pretty consistent across genders. Patellofemoral pain was kind of number one. So patellofemoral pain is any pain around your kneecap region. So it could be pain on the inside of your kneecap, outside your kneecap, under your kneecap. That's kind of the number one type of pathology that we see. And we saw a knee accounting for a large portion of the different joints. IT band, has anyone had IT band issues in the past? If you run long enough, you'll definitely have IT band issues at some point. The IT band is the connection on the outside part of your knee. So if you have pain like directly on the outside part of your knee, that's where the IT band inserts, and there's a lot of friction that occurs between that tissue and the femur below. So that can cause a lot of pain that can stop you in your tracks. Plantar fasciitis, anyone on the call have plantar fasciitis before? This one is really debilitating, really bad. So on the bottom of your foot is your plantar fascia. It's more of a connective tissue. It helps support the structure of your foot. So if we run repetitively, we start to have little micro tears in that plantar fascia. It gets swollen, irritated, and it becomes very painful with each step. Also, right along the bottom part of the heel, that's where the plantar fascia inserts on the heel. So usually these connection points into bone are where the tissue can get irritated or start to break down. Shin splints, anyone have shin splints? So on the lower leg, kind of that tibial bone right there, any pain along the bone, we call it shin splints. And as we go into the running biomechanical analysis, you guys will see some of the ways that your running form may contribute to some of these pathologies, and I'll call that out when we get there. Patellar tendinopathy, so that's any type of issue along your patellar tendon. The patellar tendon inserts on the bottom part of your kneecap and attaches to that tibia, that lower leg bone. And then Achilles tendinopathy. Anyone in here have any Achilles issues? Had that now or in the past? This one can be really tough as well. Every time we run, the Achilles is loaded greatly, especially when you're doing speed work and hills and intervals. Those type of things can really flare up your Achilles tendon. So with that, again, this is just a global view, looking at different joints, looking at different pathologies that we might come across. So different risk factors. This was one of our cross-country high school athletes. And you can see as she's doing a single leg squat here, this is one of the big risk factors for developing an injury. Every time we run, we hop from one leg onto the next, right? If we cannot control our body weight and we allow the forces to move our knee joint inward, our arch collapses, our balances off, this can cause a lot of knee pain. It can cause patellofemoral pain. It can cause hip impingement. It can cause a lot of different things. So this is one of the big ways that we can screen ourselves, and really one of the things that we want to try to increase competency with. We want to try to increase that single leg squat positioning so that we know we can withstand the thousands and thousands of reps that occur with marathon training. A previous injury. So the number one risk factor for getting an injury is a previous injury. And a lot of the times it's because maybe that injury, we had it felt like it was sore, or we had pain for a couple weeks, a couple months, but we never really got it fully addressed. You never really got the strength back in that tissue, or you never addressed why you had that injury. So a lot of times those injuries can reoccur. Novice runners, we talked about that, like first-time marathon runners, that's another risk factor. Increasing intensity, which usually occurs during marathon training, right? It's a stepwards increase in volume, and then you start to taper during the end. So men over 40 miles per week and women over 30 miles per week, which really in marathon training isn't a lot, but those people are at an increased risk for injury. Training for an event such as a marathon. Men who are under 34 years old. Isn't that interesting? Men that are under a certain age, and they hypothesize that men who are under 34 tend to push a little bit more. So if they have a little soreness, they continue to push, and they don't really listen to their body. Women who have a BMI under 21, specifically for tibial stress syndrome or shin splints, and it can progress to becoming a stress fracture in their shin, okay? So there's a lot of reasons for that. But when you have a low BMI and your body's not getting the nutrients it needs, it starts to extract those nutrients from your bone and weaken your bone. So those people are hypothesized to have a higher risk for injury, specifically those stress fractures. Okay, another big one too, and this should pop up here. Athletes who have less than 2 rest days per week had a 520% heightened risk for injury. 520%. That's a lot. So this is something that we should consider too while we're doing our training. It does not have to be a complete rest day, but it's something where you're doing a different movement pattern, right? So if you're running 6-7 days a week, you're putting yourself at increased risk for injury because you're never allowing recovery to happen. But you can rest on those days and still cycle. You can rest and still elliptical. You can rest and still swim. You can do some strength training, some core exercises. So you can still be doing exercise, but having less than 2 rest days has shown to be a risk factor as well. So it sounds horrible, right? We're talking about all these injuries and some risk factors, but again, this is just giving you guys some information. So you guys can start to think, okay, if I have one of these risk factors, you're probably okay. If you're looking at that list and you have 2, 3, 4, 5, well, then that's something that you're really going to have to pay attention to your body during this training. So what do we do? If you are in that higher risk category, there are some injury prevention techniques that we need to talk about. 1 is being smart. 2 is a proper warm up. 3 is specific stretch and strengthening routine. And we know from dealing with a lot of runners and research, certain muscles get very tight and strong. Certain muscles get very underutilized and weak. So balance is the key there. Screening your body for different movement deviations and some different recovery options. That's what we're going to talk about right now. So what does being smart mean? Slow and steady always wins the race. If you go out and you have a certain pace that you're trying to hit, and it's reasonable, and you hit that pace and you're going slow and steady, that's good. If you're trying to continuously push 4 months straight leading up to this marathon, well, that's where you can get to the point of exhaustion and really your body starts to feel fatigue. Hydration is huge. There's a drop in 2% of your body weight can really start to affect your performance. So 2% of your body weight, depending on how much you weigh, for someone who's 150 pounds, that can just be 3 pounds. So if you lose 3 pounds of water weight, which is easy to do when you're running a lot and you have a lot of miles, that starts to affect your performance. Your body loses that water. Your heart has to pump a lot harder. Your heart rate rises a lot faster during your training. So your body feels like it's exerting itself a lot harder for a normal type of run. So staying hydrated is important. 8 ounces of water for every 15 minutes where you're sweating consistently is a good starting point. 8 ounces of water for every 15 minutes that you're running. If you're running and you're going to run for more than 45 minutes to an hour, that's where you want to start thinking about some type of carbohydrate drink, right? So something with a little bit of sugar, something with a little bit of electrolytes to replace that, because as you sweat more, you're going to start to lose those electrolytes as well. Don't go to exhaustion. So if you're training and every single run you do, you're exhausted at the end, your body's going to start to break down a lot faster, right? So there is something to be said for those easy run days. Make them an easy run day. Don't try to go out there and still hit a really good time on an easy run day. Just think you're stretching it out. You're getting your body moving. You're getting ready for that harder intensity day during the week. Proper shoe wear is huge. If you guys haven't got properly fit, I strongly encourage you guys to go do that. Fleet Feet is obviously a great resource for us here in Sacramento. You go down there, make sure the shoe wear that you're wearing is appropriate for your foot. And we have some recommendations when we do put people through our screening test for the running biomechanical analysis. Proper warm-up. So in the chat, does anybody do a proper warm-up before running? Or do you rush home, put your shoes on, tie them tight, get your running shirt, clothes on, and just go out the door? Who does a proper warm-up? Any type of warm-up. Barbara, always a proper warm-up. I love it. Keegan, proper warm-up. I do a modified version, could probably do more. We hear that a lot, could probably do more. I do now with Fleet Feet, perfect. Short warm-up. Warm-ups do not have to be long at all. Leg swings mostly. Leg swings are good too. In your warm-up, you want to do a few things. You want to do a quick stretch on the tissue. Dynamic stretching is better than static stretching. Dynamic stretching is a quick, fast stretch on the tissue. What that does is it stimulates the muscles to fire quickly, which we need when we're running. Nobody runs and hits the ground and waits for 5 seconds and then goes and hops on the other leg and waits for 5 seconds. So that's why you need to do quick stretches. This is a document that if I didn't already send to Piper, I can send to her and she can share this with the group. But this is our dynamic warm up. You do 5 of these movements on each leg. When you get really efficient at it, it takes about 2 to 3 minutes to do, really fast. Every time I go run, I spend 2 minutes, quick stretch, go, go, go. And it really makes your body feel better, faster. For those of you who say, oh, I have to get through the first mile and then I feel like I'm warm, this will really help speed that up. Foam rolling. Foam rolling is super important too. So there's a lot of myths about foam rolling. Some say it increases flexibility, it stimulates muscles, it does this, it does that. There's 2 different ways to foam roll. If you foam roll back and forth over a muscle really fast, you're going to stimulate that muscle similar to the dynamic warm-up. So let's say, oh, my quads always feel sluggish when I go. Well, get on the foam roller, roll back and forth really quick, and that's going to help stimulate the receptors. This is a little chart that shows foam rolling your glutes, hamstrings, any tissue really that you need to foam roll. So again, this will be another resource for you guys. Another way to use the foam roller is if your muscles feel really tight and they can't let go, you roll over that body segment, hold over the most tender spot, and just allow that tissue to kind of sink into the foam roller. Trigger point therapy, a lot of massage therapists use it, where you just apply pressure on the muscle and you wait for that muscle to release, which usually happens over holding that tissue for a period of 60 seconds or a minute. So you guys will have that. Here's a series of static stretching that we need to do post-run. So if your calves feel really tight, your hamstrings, your glutes, these are different stretches to do. And you have to hold your stretch for at least 30 seconds up to 60 seconds and repeat 3 times, okay? That's super important. Research is very, very strict on that. If you hold it for 10 seconds, you're not really gonna affect the length of the tissue. Hold it anywhere longer than 60 seconds, kind of the same thing. So that sweet spot between 30 and 60 seconds there. Running performance is really about 2 things. It's about the beginning stance phase, which you guys see right here. You see the down leg on these guys, it's a bent to about 45-degree angle. So that's that single leg squat position that we talked about. And it's also about late stance or takeoff phase. So you see this back leg is extended here. He's up on his toes. That's what we call the triple extension position. And that's how we propel ourselves forward. If this hip is tight right here in the front, then he's going to jump upward versus jumping forward. And running is much more about going forward than upward. Upward is wasted motion. So we don't want to waste time doing that. Strength training is key. We talked about that. You guys, running constantly is not the way to go anymore. You don't need to do a ton of it. 2 days a week, maybe. As you get closer to marathon, maybe 1 day a week, very light stuff. 3 sets, 15 to 20 reps. Balance is the key. And research is really strict on this too. Hip abductors are the muscles on the outside of your hips. Hip flexors, muscles on the front side of your hips, really help that turnover. Hip extensors propel your body forward. The hamstrings and spine stabilizers do the same thing there. As we get closer to the marathon, strength training should dip drastically, right? We always tell our runners no strength training about 2 to 4 weeks leading up to the event, but this is something you want to build a base for right before the event. So 3 months before the event, 4 months before the event, that's where you start your strength training. And you build up. As your running volume increases, your strength training has to decrease. We can't continue to increase both at the same time. Again, that's how we're going to lead to overuse. Strength training exercises, these are some good ones. Single leg RDL right here. Really working that single leg glute right there on the down leg. A side plank with a leg lift. Has anyone tried this? And if you haven't tried it, try it. But this is a really good exercise. #1 exercise for activating the hip abductors, which we know are super important. The band wobbles, where you move your knee in and out, and then a single leg squat too. And we talked about the importance of that already. Here are some other good ones: ball hamstring curls, steamboats, where you're just going out to the side. Ball mountain climbers. Again, we're working on that turnover rate of the hip flexor and a bridge on the ball. Really good glute exercise. So you guys will have this. You guys can watch this presentation over again in YouTube after we're done. But yeah, these are going to be some really good exercises for you guys. So then we get to screening, the functional movement screen. It's a series of 7 different movements that we do, which really helps identify injury risk and asymmetries from side to side. The running biomechanical analysis kind of speaks for itself. We put markers on your body and look at different deviations that may occur, which can lead to some of these injuries too. So screening is important. The FMS functional movement screen, there's a lot of research with runners. If you score below a 14 out of 21, you're at a significant risk for injury. So again, this is how we identify these things. If you score below a 3 out of 6 on 2 of the movements, the deep squat and leg raise, then that correlates to injury in the runner. And this was a track and field collegiate team that they did. On the flip side of that, if you score above a 15, then you're at a significant, those people significantly increase their performance over the following year. And the deep squat, if you score 1 out of 3 out of that, they had a significant worsening of performance. So it's an injury risk assessment, but also a performance indicator as well, which is pretty cool. I have a little video on the movement screen, but we'll skip that here. And we're going to screen. So I'm going to show you guys one movement that you're going to do, and then you guys are going to do a little self-assessment for your ankle and hip mobility. Okay. How many people have done squats before? Good. See a couple hands going up. So what I want you guys to do, and I'm going to move my screen back a little bit. Okay, so what you're going to do is you're going to stand up and we're going to do an overhead squat. And let me move my chair back here. So an overhead squat is you put your hands overhead and then you're going to squat down as deep as you can go. Okay, so do about 2 or 3 of those squats and really take note of what you're feeling. Do you feel tightness in your ankles, knees, hips? What do you feel? What we want to see is your chest parallel to your shins. And when we do this in person, there's specific criteria to determine if you scored a 1, 2, or 3, right? And again, we talked about why that's important. So another little screen, quick screen that we can do is look at your ankle mobility. So I'm going to move my screen down here to the ground. So this is where you can go up against the wall. I'm going to use a foam roller here. Ankle mobility is huge. So hopefully you guys can see me here. Can you see my ankle?
Dan, you might need to take the background off.
Ah, darn background.
Just go to that start video up or stop video up screen, choose virtual background, and you can remove it quickly.
I can do this, Piper. Piper has shown me. Oh, perfect.
Awesome.
All right, cool. All right, can you guys all see me now? Okay, so what you're gonna do is put your foot up against the wall, and then you're gonna see how far you can get your knee towards that wall without the heel popping off the ground like that, okay? So we're going to measure the distance that you can push your knee over your toes and still touch that wall. If you're really far from it, scoot the foot forward. Boom, I can touch the wall right there and my heel doesn't come off of the ground, okay? So once you get that distance, go ahead and put your fingers on the ground between your toe and the wall. And typically, if you can get all of your fingers and your hand between your toes and the wall, you're doing really good as far as your ankle mobility. So not only is it important to have good ankle mobility there, it's important to be symmetrical from side to side. So being symmetrical from side to side is going to ensure that we don't have any deviations in your running form. And that ankle mobility can really make that single leg squat position difficult to do. So ankle mobility is huge. All right, I got one more screen for you guys. So you're going to lie on your back, just like this, and we're going to pull our knee in towards our chest like this, okay? So as you pull your knee in towards your chest, you're going to see how far your knee can get towards your chest. If you can't get towards your chest bone right there, then you have a hip mobility issue, which is going to restrict that overhead squat position, okay? So the two big screens that you do ankle mobility screen and that hip mobility screen. Let me get back to our presentation here. Okay, so who had poor ankle mobility? Who couldn't put their hand between their toes and the wall there? Don't be shy. Everyone had great ankle mobility? Not even close. I have dealt with short Achilles since a child. Oh, sorry, Jacob. Yeah, that's gonna be tough there, right? But again, the ankle being able to move and your knee translate over your toes, super important during that mid stance portion of running, right? Only 4 fingers. So 4 fingers is probably pretty good. Anywhere between 2.5 to 4 inches. So if you want to be very specific, you can get a ruler out and measure that. Anywhere between 2.5 and 4 inches is normal there. But the ankle mobility is kind of the #1 reason why people have difficulty with that single leg squat test and this overhead squat test too, okay? So we would try to really show you guys some ways to open up that ankle, increase that squat movement so that the running mid-stance form is a lot more ideal and decrease those little micro traumas that might occur if we have poor ankle mobility, all right? Here's the running biomechanical analysis. So I'm gonna play this video really quick so you guys listen. The running biomechanical analysis begins with the runner coming in the door, and then we have specific markers that we place on the runner's body, which helps us determine joint angles that we go over with the runner during the analysis portion. So you guys can see here kind of the process. And what's really cool about our phones now is the video quality is so good. We can draw those angles in there, and then we can really determine if someone is outside of norms. And when you're outside of the norms, those are the type of deviations that we want to address. So when we look at the running biomechanical analysis, anterior knee pain or patellofemoral pain kind of looks like this. So overstriding is a huge one. So you can see this line right here on the right. This marker on the hip, we want the line to be right on that marker. Like you see in this picture A, that's pretty close, that's good. Picture B, she's really striking out over in front of her body. Stiff landing is also an issue too. So if you have a knee angle of 20 degrees, that's a really stiff landing. All that pressure is going to go through the knee. We want the knee to be able to absorb the contact. So somewhere around 40 to 50 degrees of knee flexion is ideal. With this overstride in particular, they've done multiple studies where they looked at the force of hitting the ground when you're striking underneath your body versus out in front of your body. And if you strike out in front of your body, a nice normal bell curve that you see here turns into a little spike right there and then jump of force. Now, this may not seem super severe when you're looking at this curve, but that's just one contact. Think about doing that thousands and thousands and thousands of times. It's like taking a hammer and hitting the bottom of your heel every time you strike the ground. Eventually, that's going to cause some anterior knee pain, and that's one of the ways that we screen for that anterior knee pain. Here's a couple things that we see with anterior knee pain as well. Hip drop. So this is weakness in this left hip. So as you load your body, this left hip drops out to the side and the right hip drops straight down. So that's going to lead to a lot of torque in the knee and cause anterior knee pain. Vertical displacement is, again, jumping up and down versus jumping forward. We measure that with these 2 markers here. If it's more than 3 inches, then we work on some drills to get you to move forward or work on opening the hip up to get you to move forward versus moving up. Excessive dorsiflexion and lack of hip extension, both of these look like this, and those can lead to Achilles tendinopathy. So if the Achilles is stretching out a lot or being overutilized, that's going to cause a lot of pulling on the tendon. Lack of hip extension, this is a big one. When you can't extend your hip, you don't use your glute, but what you do use is your calf, and you overutilize your calf. So then we got to work on opening that hip up in this situation as well. IT band or tibial stress fractures. This is kind of what we were talking about earlier. Crossing midline is a big no-no for this type of injury. The foot comes across the midline, and then there's a lot of pressure on the inner shin right there. There's a lot of pulling on the IT band on the outside part of the thigh. Too many toes / pronation So if your foot caves in, then that's going to cause a lot of stress on the inside part of your shin as well. So when we look at screening, we look at the risk factors. What do we do for this? We talked about stretching, we talked about warming up, we talked about being smart, staying hydrated. All that stuff is super important. But you guys are doing a lot of volume, so there are going to be little sorenesses that pop up here and there. And again, if you stick by that pain after activity, pain during activity but not limiting running, pain that now is limiting running, and pain that's not causing you to run, we really want to get those injuries kind of identified and checked out in those phase 1 and definitely into phase 2 before it becomes phase 3. Because if we catch it soon enough, we can do things like working on your mobility by doing some cupping therapy, which increases blood flow to the area. It increases flexibility of the tissue. It allows you to have a more normal gait pattern with running. Graston, if anyone's used Graston in the past, it's another way that we get and break up all the fascial linings. They get torn down when you do run a lot of miles. So we want to restore that normal range of motion in order to have you run safely and effectively. And again, we can do this in the early phases. The Alter-G treadmill, if you guys haven't heard of the Alter-G treadmill, we're one of the only facilities in Sacramento that is open to the public. So if you have pain that's restricting your running, we can still get you in here and run at a decreased percent of body weight. You can run at 60%, 70% of your body weight, decrease the force, continue to train through your injuries. Normatec compression. So these are compression boots that help flush out all the waste materials that occur after tissue breakdown. And it really helps speed up recovery afterwards. So if you have one of these or you have a buddy that has one of them, definitely get in those a couple times a week and flush out all those toxins that can lead to the muscles feeling sore and continuously feeling sore when you run. Who has a Theragun? This becomes super popular. And I know there's a lot of myths on the Theragun. It increases flexibility, muscle activation, all this stuff. The one thing the research is consistent on with the Theragun and percussive massagers like this is it decreases muscle soreness, but doesn't do any of the other stuff. But it's super valuable, right? As you guys are running a lot of miles, your quads are going to get sore, your calves are going to get sore. It is a good tool to decrease that soreness so you can continue to run. But that's all it's going to do. It's going to decrease the muscle soreness, which is valuable. Runner's recovery package. This is something that we offer all runners, especially during the marathon training. We have the percussive guns. So you come in, you get on the bike, you get your blood flow going. We go up and down all your lower extremities, spend a little extra time on the tight muscles. Game ready unit is an ice compressive unit. So for those joints that are feeling sore versus the muscles, it compresses and squeezes that fluid out of there, allows you to get that waste out of there, new blood in, old blood out. And that's what helps with recovery. And then the Normatec compression boots too. Again, this is as close as we can get to doing ice baths, which would really help flush out your legs, but it's not very sanitary for us to have a huge bucket of ice bath in our facility and have multiple people use it. Just takes too long to help clean. So we can spray these things down. We have about 4 different pairs and help get people feeling better faster. So summary, I know we talked about a lot of stuff. Repetitive running can lead to injury. I think we all know that, but let's be proactive. Develop a strength and stretching regimen that can help best suit you as you continue to train for this marathon. Screen for injuries before they happen. So we always have people come in a couple months into training. It's ideal to do it at the beginning. We're kind of in the middle right now, but it is important to get screened so you can identify some of these risk factors. Address minor injuries before they become major. So those phase 1s and 2s, we want to identify those and make sure they don't become bigger issues in the future. And if we do that, you guys are going to run fast, strong, long. You're going to perform really well. Again, remember that video where that girl didn't perform very well because she was unable to finish the race. These are a list of our services. We do have a really good running workshop that's coming up, and we offer a discount for all people who are on this call right now. So it's usually $100 for a 3-hour workshop, which is pretty darn good. And we have one of our certified Chi runners, instructors, Matt Sheehy, does an excellent job. You guys get your running form looked at, you get exercises, you get running drills, and it's really specific to the deviations that you have. So you guys can give our office a call. Again, this presentation is going to be up on YouTube. So you can take a screenshot of this, take a picture with your phone, and give us a call. if you're interested in any of that stuff. Otherwise, I'm going to open it up to Q&A right now. I think we have about 10 more minutes or so. So if you guys have any specific questions or anything about the presentation, we can kind of handle those questions as we go. These are my two little kiddos. They're just now getting home, so I hear them screaming in the house, but they're showing their muscles off, big muscles and strong little kids here. So with that, I'll open up to any questions.
Go ahead and put your questions in the chat box and we'll be able to answer them from there.
Let's see what we got. So we got Sloan. Any pointers on getting the most out of PT when the doc is only doing virtual visits? That's interesting. Yeah. I think virtual visits can be of benefit because you can, like, we can evaluate by watching you do specific movements or seeing where it hurts. I think it's always better to be in person, just, depending on the provider that you're working with and their comfortability with that at this point. It's always better to be in person because we can actually feel the tissue, move you, check ranges of motion, check strengths in person to give you guys the best treatment possible. But virtual visits can be beneficial. If you do not feel like they are, then find a provider that is seeing patients in the clinic or in their office. Amanda says, do you think massage is helpful to recover? That's one thing that I didn't talk about, and I need to put that in the slide. Massage, above everything else that we talked about tonight, is the #1 way to get your muscles to feel better. Okay, #1 by far. All the research suggests that. They've done studies where they compared massage to the percussive therapy, to self-stretching, to foam rolling, and massage works the best. And I think part of that is you have someone touching you, you have someone working on your muscles, you're able to relax. It's not like you're on this foam roller that hurts, right? So having someone's hands on you and kind of mobilizing your tissues, especially those tight tissues, really helps, again, fluid exchange, moving blood in, moving blood out, and that helps with recovery. Okay, we've got a couple more. If you have level 3 pain, how long should you rest before restarting running? If you have level 3 pain, again, there can be a lot of different reasons why you have level 3 pain. A good time frame to start running after that would be at least about 7 days, 5 to 7 days. And that's the typical response of inflammation. So typically run, if you're having pain that's stopping you now, something is becoming inflamed and really irritated. You want to give that appropriate time to kind of calm down. Use some of the techniques we talked about. Icing is really good with that. Stretching, foam rolling, all that thing will really help speed up your recovery. And then try to go back into it slowly. If you run, a mile and it feels good one day, then that's cool. Wait, run 2 or 3 miles the next day. If you have pain, stop. But then that's where you might want to get it checked out by a professional. You might have a new client, smiley face. Perfect. And we're here for you guys. We really want to be a resource for you guys. And that's why we do these talks. And that's why we want to support you during this process, because we know everyone has a goal. No one wants to stop because they have pain. And we want to continue to keep you guys running throughout this process. How important is chiropractic care? With massage, chiropractic care is really up there too, right? And I think you guys have a lot of options now. You have massage therapists, chiropractors, physical therapists, primary care physicians who may or may not do things, personal trainers you guys work with, running coaches. So all these professionals are resources for you guys. And if you already have a good relationship with a chiropractor who you've worked with before, that's who you go to. You say, hey, I have this issue. I've been running. I have this issue. Can you help me out? And if it's someone who you trust, you just go to them and let them help guide you throughout this process. My piriformis ? Issues have lessened after, my piriformis issues have lessened after the percussion massager, but it is a bit persistent. Not debilitating, but I feel it all the time. So with that, what I would say is, again, the percussive therapy is going to help decrease muscle soreness kind of right away. But it may not address the underlying issues that you're having, whether that's a strength issue, a flexibility issue, maybe it's a running deficit, a form deficit that you have. So again, that's where going and get it checked out. If it's something that's persistent, something that lasts more than about 2 weeks and is not going away, that's what I really urge you guys to go and get it looked at by a professional, get it looked at a little bit further, so we can really identify what's going on. Any advice about Achilles tendonitis? Yes, I have a ton of advice about Achilles tendonitis. If it's something that is popped up kind of acutely, like you went and did more of a speed workout or a hill run and it just flared up, icing it, getting it to feel better. Ice is going to help get the irritation level down. That's the big benefit of ice. Now, do you stretch it? Do you strengthen it? That's where I can't really tell you guys that as general advice. You can try stretching. You can try doing a calf raise where you hold up at the top and just get the muscle to contract. Sometimes that helps with pain, and it's pretty safe to do on your own. If there's something beyond that and that's not really helping, again, I keep going back to that, but get back to the healthcare provider that you really trust and is going to help you with that. Any advice about groin strains? So here's the thing about tendonitis, muscle strains, anything that is starting to hurt. What you want to do is, if it's painful walking, definitely running is not going to feel good. If it's painful with a single leg squat, definitely running is not going to feel good. If you hop on one leg and it hurts, running is not going to make it feel good, right? So then you might have to modify your running a little bit. You still need to run, but maybe not as much. If it's something acute, where it hurts all the time, you got to get the irritation level to calm down. You can try light stretching. If it feels like a global stretch, we're cool. If you're stretching, it's like, ooh, it's pinpoint. I feel it right in this part of my groin. That's not cool. You need to back off a little bit. Try the foam rolling, roll over it. Try to just hold right over that tender spot. And if it starts to dissipate and feel better, you're releasing that muscle. If it's feeling worse, get off of it. That's not something you want to mess with. But for all of this stuff, really, you have a little strain. It should get better in a week or two. If it's progressing over 2 weeks and you just can't get rid of it, that's again where we need to get it checked out. Would assisted stretching possibly help with short Achilles problem? I'm not sure what we mean by assisted stretching, but if you're talking about someone stretching you, yes, that can help. But really, a calf stretch is really easy to do on your own. You go up against the wall, you put your hands against the wall, 1 foot forward, the other foot back, leg straight for that back leg, and that gets the upper gastroc muscle. Move that foot closer to the wall, bend your knee, you get more of the soleus muscle, more of the muscle that is close to the Achilles. So that's where, the percussion gun can help, the foam roller can help, getting a massage, getting cupping grassed in to help open up that tissue can be really beneficial. Piper, how much time do we have left here?
Thanks for asking. We've got 2 minutes until 7, but if you're open to taking some more questions here, we can certainly stay on.
Sure. Yeah, we're cycling through these. And if you guys have if I'm not answering these the way that you like, go ahead and throw that in the chat too. Piper is really strict on time. She told me if I was not done at 7 o'clock, she would cut me off.
I said we start at 6. We're starting at 6.
If the screen goes blank in 2 minutes, you guys go out. Okay.
No.
Okay, I have pain on the bottom of my foot in the middle of the arch. No pain in the heel. Doesn't impact running, but hurts otherwise. Is this plantar fasciitis or possibly injury to the foot arch itself? This is a great question. And you have the plantar fascia that's on the bottom of your foot. Usually it's where it attaches into the heel is where you're going to get that plantar fascia symptoms. You can also get it in the middle of the arch too, but also in the middle of the arch, you have a lot of bones right above that. So that's something where we want to make sure it's not a bone issue. If it doesn't impact your running, then you're probably okay. If it's something where it starts to impact your running, again, that's where you're going to probably get into the phase 2 or 3 of that injury cycle, right? So I would focus on kind of doing some light rolling with the ball on the bottom of your foot, try to stretch the foot out a little bit. If it's hurting just walking around, then or if it's hurting at rest, that's where you need to get it checked out. Okay. But if it's not hurting at rest, then you should be okay. There's also your posterior tib tendons that insert right into the bottom of the arch too. So it could be a problem with those guys. But again, kind of difficult to say without taking a look at it. Okay, I know everyone is different. Great way to start the question. I love that, Amanda. But what would you say is the best running shoe? Oh my goodness. The best running shoe, and this is a general question, so I'm going to give you a little bit of a general answer. The best running shoe is the running shoe that feels the best in your foot by far, right? So if you guys have flat feet, high arches, if your big toe is up compared to the rest of your foot, if your heel is rotated compared to the rest of your foot, if the shoe feels good to your foot, that's the absolute best shoe you can wear, regardless on your foot structure. The reason for that is if the shoe doesn't feel good, the chances of you rolling to the outside or rolling to the inside or not fully putting your foot down on the ground to avoid that discomfort is going to be more harmful than anything else. So a shoe that feels the best is the best running shoe for you. I have sort of knee on the outside pain. If push too hard to try, if pushes try to find sore spot, it is on the outside edge of my calf, only on one leg. Take 2 days to go away. What should you do? Yeah, and again, guys, with all this stuff on the outside, it could be a couple of different things on the outside. The best general recommendation I can give, if it takes 2 days to go away, remember that slide that we talked about. If it's more than 24 hours, we're doing something that is causing stress to the tissue that the body's not able to recover from, right? If you have soreness on the outside part of your knee and it lasts less than 24 hours, you're probably okay. So look at the activity level that you did the day before. Let's say you went and did a 10-mile run and it was sore for 2 days, but then the next day you did a 6-mile run and then it was sore for only 1 day. Well, there's some type of issue going on between 6 and 10 miles that is causing too much stress for your body to withstand, right? So I would recommend kind of staying in the run range that feels the best, minimal soreness that goes away within 24 hours. If it's over 2 days, we need to take a look at that. Is sports massage few days before the race good? Sports massage a few days before the race is good, yes. So there's some controversy of doing it like on race day or even the night before, but I would say if it's 24 hours before, you're probably doing pretty good. If you get a little bit closer, you're probably okay too, but I would say 24 hours before would probably be the best. Okay, hip problems, possibly hip impingement. What can be done in order to keep running? Yeah, so if you're feeling pain in your groin or the front of the hip, with running, typically it's in that when the leg is going behind your body and you're feeling some pressure in the front of the hip, that's where you can try to do some of the light hip flexor stretching. And again, this is just general stuff for you guys. This isn't medical advice or anything, but icing is always good. Light stretching, if it's painful, don't do it. If it continues to persist, then you got to get it checked out. But if it's when you hit the ground every time and then you have pain, that's where we need to take a look because it could be a couple different things there. How long should you stretch after a run? Great question. So stretching after a run, you want to hold for about 30 to 60 seconds, a static stretch, and you want to repeat that stretch 3 times. Sometimes it takes a little bit longer to get into the stretch and relax into the stretch. So if you relax really quick, 30 seconds could be good, but if you feel like you're still just getting into the stretch, hold it up to 60 seconds. Anyone live in San Francisco?
You can skip that one. It's just a plug.
Oh.
Yeah.
Okay. What can one do to improve posture during running? And what can one do not to run up instead of forward? Very good. Yeah, very good question. So improving posture during running. So typically you want to be upright, right? You don't want your shoulders slumped. You don't want to be rounding from your spine. Good running form is not being straight vertical, but a slight lean forward. And that lean forward is coming more from your ankles versus your hips, right? So there is a running drill where you work on just standing and bending forward from your hips until you fall and kind of go forward. So for people who have that vertical displacement where they're jumping up and down, that's a really good drill that we do with people. Another drill like that is standing with your toes up against the wall like this. So here in the wall, and then you move 1 foot back from that. And then you do the same thing. So you kind of lean into the wall. Your forehead is now on the wall and you're bending from your ankles to feel kind of that forward falling position. Because really you want to propel yourself forward. You don't want to be jumping up and down. So those are a couple things you can try. Another thing, if you're running and you feel like whatever you're looking at is doing this up and down, then you're probably jumping up and down. So focus on something in the distance and try to get that, whatever it is, that tree, that car, to not go up and down. So your eyesight can help you with that vertical displacement as well. Thank you very much. Okay, thank you. Good. What are the fees for consultations regarding gait running form analysis, especially if we've had a slightly rotated hip and abnormal gait since childhood? Yeah, so if you guys have questions on that stuff, I think I put my email on the presentation. Go ahead and shoot me an email and I can talk to you guys about those rates. But yeah, running analysis, it's really easy to do. We typically spend about 60 minutes with you, put those markers on just like you saw in the presentation, video from the side, video from the back, and then really try to identify some of these deficits that we see. When I stretch shortly after running, I usually do not feel the stretch. Is there an optimal time after running when stretching is most effective? Shortly, I usually do not feel the stretch. Well, that's good. And if you're trying to stretch a tissue and you don't feel the stretch, then it's probably pretty good. It's probably not a tight tissue. So we shouldn't have to stretch every single tissue in our body after we run. You should only focus on the tissues that feel tight afterwards, right? And stretching is going to help relax that muscle. So if your calves feel tight, stretch your calves. If it's the front of hip, stretch the hip flexor. But if you're trying to stretch your hamstring and you can't really stretch it, you can't feel a stretch, then it's probably a normal resting length. Okay, one more question, but is CBD good during or after a run? That's something that I'm not too familiar with, and I haven't really seen literature on it in the research. So I'm going to go the safe route and just not touch that one. Is jump roping considered a good cross-training activity? Jump roping is a great activity, but again, jump roping is doing a similar motion to running. So when we talk about cross-training, we want to do something that is like a different movement pattern than running. So if you're jumping, you're hopping, you're loading the tissues very similarly than what you would do with running. Like we talked about, cycling, like the elliptigo is good, elliptical is good, spin bikes, swimming, some strength training, core training stuff. Like those would be some good options on your rest day or your active recovery day. Whew. All right, we did it. Oh no. Oh, thank you. Okay, cool. And go Giants. Yeah, go Giants. Giants tonight. So we're finishing up right when game is starting, I think. So we should be good there. Well, thank you guys. I appreciate you guys' attention. This is a great group, a lot of interaction in the chat room. So I think that makes it a better presentation. I think everyone learns a little bit more from that. So I appreciate you guys' willingness to put stuff in the chat. See you, Joe. Thanks, Joe. Otherwise, Piper, if you're good to go, I'm good.